Warren. This is June 3rd, 2022. This is my head to toe assessment. I'm just painting my room. It's my patient behind me here. I'm going to begin by coming in the room, knocking on the door, coming in the room, washing my hands, introducing myself. My name is Kristen. I'm a nurse practitioner student. I'm going to be performing a physical assessment on you today. I've already got signed consent. I am going to start by assessing skin. I'm looking at the overall temperature, texture, color, moisture, turgor, any edema, bruising, scars, moles on the face, head, neck. I'm also going to look at her abdomen, posterior and anterior chest. And then I'm going to assess the head for shape, symmetry, size, and tenderness. I'm next going to go to the scalp. I'm looking for hair color, hair distribution, hair texture. I'm going to palpate for any depressions, lesions, masses, or infestations. And then I'm going to palpate the temporal arteries. And then lymph nodes, I'm doing preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. Next, I'm going to move to your jaw. I'm going to be assessing TMJ. Can you open and close your jaw for me? I'm assessing for subluxation, any crepitus or tenderness. Okay, and then if you could clench your teeth for me. And close your eyes. Tell me where I touch.
My forehead, my nose, my chin, my cheek, my cheek.
Okay, and that's cranial nerve number 5 intact. Okay, now if you could clench your teeth, puff out your cheeks, pucker your lips, raise your eyebrows, smile, and frown. Okay, that's cranial nerve number 7 intact. It's still good. And then I'm going to move to your ears. I'm looking for the shape and the symmetry and size. I'm going to palpate the pinna and tragus bilaterally for any tenderness. Then I'm going to look into the auditory canal by pulling the pinna, turn your head to the side a little bit, by pulling the pinna up and back. And I'm going to do this on both sides. Okay, then I'm going to perform the whisper test. If you could occlude this ear for me and tell me what I say.
ABC.
And then this side.
1, 2, 3.
Okay, and then I am going to perform the Weber test. I'm going to strike the tuning fork. Tell me if you hear this in one ear or both. Okay. And then the Rhine test, I'm going to strike the tuning fork, and I'm going to put it back here on your mastoid bone, and I'm going to do this bilaterally. And then tell me when it stops.
Stop.
Okay, and then strike the tuning fork again, perpendicular to the ear. Tell me when it stops.
Stop.
Okay, and by doing this, air conduction is greater than bone conduction, and that's cranial nerve number 8 intact. Next, I'm going to move to your eyes. I'm looking at the brows, lashes, palpable fissures, and then I'm going to pull the eyelids down. I'm looking at the sclera, conjunctiva. I'm looking for any discharge, color, or lesions. And then I'm going to get my Snellen eye chart. If you could close one eye for me and read this line.
FPH.
And then the other eye.
FPH.
Okay. And then look at my nose and tell me how many fingers I'm holding up. And how many fingers I'm holding up on this side? 2. Okay, that's peripheral vision, and cranial nerve number 2 is intact. Okay, now I'm going to have you follow this into your nose. Good. And then without moving your head, follow this. Good. And then I'm going to check your pupils. I would turn the lights off and check the pupils for direct direct light bilaterally, and then consensual light bilaterally. And pupils constrict to direct and consensual light. And that is cranial nerve number 3, 4, and 6 intact. Next, I am going to follow the red light reflex into the optic disc and look at all other internal eye structures. And I'm going to do this bilaterally. Okay. Then I'm going to move to the nose. I'm looking to make sure that the nose is straight and midline. And if you could close your eyes for me, smell this and tell me what it is.
Coffee.
That's cranial nerve number 1 intact. And then occlude each nostril and breathe. Okay, and the other side. Okay, and then I'm going to palpate the frontal and maxillary sinuses for any tenderness. And then I'm going to move down to the mouth. I am going to assess the lips, teeth, gums, tongue, floor of the mouth, posterior pharynx, tonsils, buccal mucosa, salivary ducts, palate, and posterior pharynx. Not sure if I said that or not. So open your mouth, stick out your tongue, and say ah. Okay, the uvula and palate rise and fall symmetrically, and then take your tongue and go side to side. Okay, that is cranial nerve number 9, 10, and 12 intact. Okay, now I'm going to assess the trachea as midline, and then I'm going to come behind the patient and have her swallow, and that's assessing the thyroid. Then I'm going to palpate the carotid arteries bilaterally, one at a time. Okay. And then I'm going to have you turn around as much as you can. Okay, and then I am going to move to the posterior chest. I'm going to ensure that I'm looking for any deformities and make sure that everything's symmetrical. If you could just take a big deep breath, and the chest rises and falls symmetrically. Then I'm going to assess for tactile fremitus. If you could just say 99 as I move my hands.
99, 99, 99, 99.
Okay. And then I'm going to palpate the intercostal spaces. Okay. And then I'm going to listen to all lung sounds. Take big deep breaths for me. Ensuring that I get the lateral lobes and the right middle lobe. Okay, now I'm going to assess for egophagy. If you could just say E at each time I move my stethoscope.
E, 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 E.
Okay, and bronchophony. If you could say 99 each time I move my stethoscope.
99, 99, 99, 99.
Okay, and whisper pectocrilically. If you could just whisper ABC each time I move. Okay, good. Now you can turn back around for me. Okay, and on the front, I am also going to assess to make sure that the chest rises and falls symmetrically. Take a deep breath. Okay. And then tactile fremitus, 99 each time I move my hands.
99, 99, 99, 99, 99.
Okay. And then I'm going to listen to your lung sounds again up front. Take deep breaths. Ensuring that I get the right middle lobe. Okay, and now I'm going to listen to heart sounds. I'm going to listen to the aortic, pulmonic, Erb's point, tricuspid, and mitral. And I'm going to hold my stethoscope here for 1 minute. And then I'm going to do the same thing with the bell of my stethoscope, aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I'm going to palpate the PMI, which is at the mitral space. Okay, and then I'm going to have you lie back. Let me get you. At about 30, 40 degrees, I'm assessing for JVD on both sides. And then I'm also looking for any heaves and lifts. Okay, and again, I'm going to listen to the heart sounds lying down. You can see aortic, pulmonic, Erb's point, tricuspid, and mitral. I'm going to do the same thing with the bell. Aortic, pulmonic, Erb's point, tricuspid, and mitral. And then I'm going to palpate the auscultation points. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Okay, and then I'm going to assess the abdomen. I'm looking for contour and symmetry. You don't have to push it. And I'm going to auscultate all 4 quadrants, vowel sounds. Okay, and then I'm going to percuss, looking for any dullness or tympany in all 4 quadrants, and then palpate for any masses or tenderness in all 4 quadrants. And then I'm going to assess for your, palpate for your liver if you can take a deep breath in. Okay, and then on this side for the spleen. Good. Now I'm going to auscultate at the aorta with my bell, the bilateral renal arteries, bilateral iliac arteries, and then the bilateral femoral arteries. Okay, you can sit up. And before, keep turn so I can sit, so we can see your back here. Now I'm going to assess for CVA tenderness. Okay, now you can turn around. Okay, now I'm going to assess the color, temperature, moisture, any edema, swelling in the upper and lower extremities. Okay, I'm going to assess the joints in your fingers, wrist, elbows, and shoulders. I'm looking for any redness, swelling, deformities, nodules. And then I'm going to assess capillary refill on both hands, all fingers. Good. And then radial pulses. Okay, and now I'm going to assess range of motion in your hands. So if you could flex your fingers, extend, hyperextend, put them apart for abduction and together for adduction, and then do thumb opposition. Okay, and then the wrist, we're going to go flexion, extension, hyperextension, flexion, extension, hyperextension. Radial and ulnar deviation, so kind of like that. Okay, and some rotation. Okay, good. Elbows, we're going to flex, extend, hyperextend. Okay, shoulders, we're going to flex, extend, hyperextend. Okay, good. Abduction with shoulders, abduction next to you, internal rotation, internal rotation, external rotation, and circumduction. Both of them. We're going to do both of them. Okay. Then I'm going to assess the strength in your hands. Squeeze both my hands. Good. And then push up bilaterally against me for, I'm checking for bicep strength. And then push against me on my hands for tricep strength. And then shoulders, if you could push against me. Put your arms out and kind of go up against me and then down against me. Good. And then shrug your shoulders against resistance. Good. That's cranial nerve number 11 intact. Next, we're going to do some cerebellar coordination with rapid alternating movements. We're going to do the hand flop. And then we're going to do the serial finger opposition as fast as you can with your eyes closed. And then you're going to spay your fingers and put them back together with your eyes closed. Okay, good. Okay, close your eyes. I'm going to put something in your hand, and I want you to tell me what it is. I'm assessing now for graphesthesia. I'm sorry, sterignosis. What is this? Okay. And then keep your eyes closed and open your hand. I'm going to write something in your hand, a number. Tell me what it is.
10.
Okay. Now I'm going to test for sensation. Keep your eyes closed and tell me if this is soft or dull or sharp.
Dull. Sharp.
Okay.
Dull. Sharp.
Okay. And now I'm going to test for vibration on your wrist. Tell me when this stops.
Now.
Okay. And I'm going to do that bilaterally. And then the same with your ankles. I'm going to go ahead and do those since I'm already here. Make sure you can see your ankles. Yeah. All right. Okay. And I'm going to do that bilaterally. Now I'm going to assess reflexes. I'm going to do these bilaterally. I'm going to do the brachioradialis on both sides. Bicep. The tricep here behind the arm. Patellar, let your legs swing. Okay, Achilles behind the ankle here. And then Babinski under the foot. And I'm going to do all of those bilaterally. Okay, now I'm going to make sure we can see your feet. I'm going to palpate all the joints in your toes, ankles, knees, and hips. Again, I'm looking for any nodules, redness, swelling, pain, deformities. I'm going to check capillary refills in the toes on both feet. I'm going to assess dorsalis pedis and posterior tibial pulses bilaterally. And then we are going to do strength in your ankles. Range of motion. So if you could dorsiflex and then plantar flex, which is down, and then inversion, which is in, and eversion, which is out, and then rotate. Good. I'm going to assess the strength in your ankles now. Push against me, or dorsiflex against me, so push up against my hands. Good. And then plantar flex down against my hands. Good. Same thing for your knees. Push and pull against me. Pull and then push against me. And then for your hips, we're going to go out and in. Push out. Good. And then in. Good. Okay. Now I'm going to have you stand up. Make sure we can see you. Okay, so now we're going to do flexion with your knees. So we're going to flex, stand straight for extend, and then hyperextend out. And we're going to do that on both sides. Flex, extend, hyperextend. Okay? And for your hips, you're going to do the same. You're going to flex, extend, out, and hyperextend all the way out. And then on this side as well. Flex, extend, hyperextend. Okay? I didn't do your knees. You're gonna have to. Oh yeah, I did. I'm sorry. Okay, now I'm going to have you turn around. I'm going to assess the spine. I'm looking for any curvatures, midline, straightness. If you could bend forward for me just a little bit, kind of bend at the waist. I'm assessing for any scoliosis. And then, okay, come on back. And we're going to do the same thing. We're going to flex with your back. So you're going to flex, extend, hyperextend, lateral flexion, so each side, and then rotation. Okay, same thing with your cervical spine. Flex, extend, hyperextend, lateral flexion, and then rotation. Okay? And now I'm going to do the Romberg test. I'm going to have you stand with your feet together and your eyes closed. Okay? And then kind of stand where I'm standing, or there's fine too, and walk towards me. You can open your eyes. And then turn around the other way and do it heel to toe. You know what I mean? Like this. Okay, good. And then hop on one foot. Okay. This concludes my assessment. Thank you.